right, so first and foremost, thank you all again for showing up. My name is Nicole DeVita. I am the VP of Technical Professionals for VFNHP and the President of Healthcare for AFT Vermont. Why are we here? Because we refuse to allow essential healthcare services to be cut from our communities. We cannot allow the network to make these cuts and restrict access to care when our healthcare system is already broken. We cannot allow the network to reduce the number of patient beds. The answer is not to cut services. Our patients, members, and community should not have to suffer due to the network's fiscal irresponsibility. We will continue to call out the network on their greed and unacceptable decisions that will endanger the lives of many. We are here to care for our patients, and we will not stop until the network reverses these cuts. I'm going to hand the mic over to Heather Bauman and let her introduce herself.
Hi everyone, my name is Heather Bauman. I'm a phlebotomist at the hospital. I am also president of Support Staff United and also vice president for AFT Vermont for Healthcare. The Green Mountain Care Board charged our employer, UVMMC, with lowering their revenue. They were to cut their revenue. They were not ordered to cut costs. They've inflicted change upon us as bargaining unit members and upon the community by choosing to close dialysis centers and to shut down the transplant center. Those areas do not generate huge amounts of revenue. What they do is they keep Vermonters alive. The Hammery report said that Vermont needs more primary care. We need services in our communities. And the response of our employer, of the health network, was to close 2 full, vibrant family medicine practices in Berlin and the Mad River. It's unconscionable. These things do not cut revenue. They are cutting costs, and they're cutting access for Vermonters to health care. We're here because we care deeply about one another. We care deeply about the patients we serve, and we care deeply about our community. We value our relationships with our colleagues, and also as patients, we value our relationships with our healthcare providers. These relationships are extremely personal to us. But don't be fooled. UVMMC is a big corporation with big corporate interests, and there's no place on their ballot sheets to reflect the value of care. And there's no line on their ledger that reads healthy community. It is our job not just to clean your rooms and to bring you your meals and to draw your blood. It is our job as UVMMC employees and as Vermonters to hold our corporate employer responsible and accountable for what really matters. We say no to cuts to patient care. No cuts to patient care. Thank you. So when we start to march, and when you get to the corner where we're going to first cross the access to the ED, we're going to not just collect the signs, but ask that folks hold silence when we get there. We need to take a moment and reflect about our neighbors, about our family members, about our patients who will be impacted by this. And so we will be silent as we go down the hill, as we reflect on what it means to lose this care in our community.
Patient needs, not their greed. 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 Patient needs, not their greed.
That's where.
Hey, hey, ho, ho! Reverse the cuts, they've got to go. Hey, hey, ho, ho! Reverse the cuts, they've got to go. Hey, hey, ho, ho! Reverse the cuts, they've got to go. Hey, hey, ho, ho! Reverse the cuts, they've got to go. Hey, hey, ho, ho! Reverse the cuts, they've got to go. Hey, hey, ho, ho! Reverse the cuts, they've got to go. Hey, hey, ho, ho! Reverse the cuts, they've got to go. Hey, hey, ho, ho! Reverse the cuts, they've got to go. Hey, hey, ho,
there's soup, there's bagels, and really, thank you for being out here. Keep talking about this. We'll have more actions. This is not over. These cuts have got to go. So just to repeat, from the People's Kitchen, if you line up over by Jordan, he's still over there, there's soup, there's bread, and just tons of gratitude for y'all for being out here, for taking time. Let's take care of each other, let's take care of our patients, let's take care of our community, and let's stop these cuts.
I just wanted to thank everybody one last time for taking the time out of your day. And like Heather said, this isn't over. We have to keep continuing on. We have to keep pushing. The network is not going to budge unless we show up each and every time. So let's keep at it. Everybody go over there, get some food. And again, thank you very much for showing up.
My name's Brett Rhodes. I'm a licensed nursing assistant on the inpatient neurology department. Basically, we all got together today to push back against the budget cuts that are happening, and it's affecting patient care and it's affecting staff. And really, it's just a symptom of the greedy, for-profit healthcare system. And
Hi, I'm Becky Searle Schrader. I am an overnight code operator for the hospital call center. I'm here today because the choices that the health network has made are going to cost patients their lives. They are choosing their paychecks over patients' lives. The care board did not make them make this decision. The health network chose to cut services to some of the most vulnerable and fragile patients. 125 dialysis patients out in the cold in the middle of a Vermont winter. Mental health patients in an underserved part of our state have no inpatient care after this decision. It's deplorable, it's reprehensible, and they need to reverse it.
My name is Heather Bauman. I'm a phlebotomist at the main campus of UVMMC, and I'm president of UVMMC Support Staff United. I am so proud to be doing this work with my colleagues in phlebotomy and with the 2,300 support staff at the hospital. We're an integral part of the team that keeps our community healthy. We got into this work because we live in the neighborhood. These are our friends and family that we want to help support and take care of. And when UVMMC announces draconian cuts to the care that we provide, it means that our friends, our neighbors, our family members, our colleagues at the hospital will not be getting care, and it's unacceptable.
Hi, my name is Brandon Lawson. I am a medical assistant lead here at the UVM Medical Center, and I'm a member of our union, UVMMC Support Staff United. We're here today because we are organizing a rally to protest cuts to services that the hospital has planned. Our regulator, the Green Mountain Care Board, came back and told the hospital that they need to cut revenue, but instead they have chosen to cut costs and patient services. So we are out here encouraging administration to reverse the cuts. Do not cut services to our communities, to our patients. We're going to be out here until they stop the cuts.
Hi, David Zuckerman, Lieutenant Governor here, standing outside the Vermont Federation of Nurses and Health Professionals offices across from UVM Medical Center, and really standing in solidarity with folks as we look at the cuts coming to the healthcare system that then are going to impact everyday Vermonters. And we know we have a system that, if we were to make the necessary changes, could be a universal system where more money goes towards patients and professional health care and people's outcomes rather than some of the overhead costs with insurance companies and otherwise. Right now, people across the state are really concerned about program cuts and services cuts at hospitals such as this and a lot of smaller hospitals around the state. And local community members are up in arms. It's not okay. You need to get the medical care you need. There may be ways to shift some programs to different hospitals, but not to cut them out. That is a real problem. So I hope folks will make sure they stand in solidarity with their neighbors who need health care and their neighbors that work in the healthcare profession. Thank you.
My name is Jacob Berkowitz. I am a leading member of Support Staff United, and we are here to protest the the cuts that are being made, so many of them are going to affect patient care in many negative ways. The cutting of dialysis clinics, inpatient psychiatry at CVMC, reducing the amount of beds in inpatient by 50. It's all unconscionable. Like, the patients aren't going anywhere. And patient care is going to suffer markedly, especially in a poor state like Vermont, rural state. The closing down of any aspect of the healthcare apparatus is just unconscionable. So we hope, folks in the community are seeing this and call on the hospital's executives to rethink the cuts and make them more appropriate and fall better in line with the Green Mountain Care Board's recommendations.
Hi, my name is Nicole DeVita. I am a certified ophthalmic technician at UVMMC and also VP of Technical Professionals for VFNHP and the President of Healthcare for AFT Vermont. We are here today to have a rally in response to the cuts that have been proposed by the network on dialysis, primary care, and mental health services. We are opposed to these cuts. We cannot cut care for Vermont. We already know that our healthcare system is broken, and by cutting essential services to Vermonters, it is not the answer to fixing this solution. We need to have increased access. Currently, in the primary care facilities that the network has announced these cuts for, there is already a 600-person wait list. We already have emergency rooms that are overburdened. Where are these people going to go for care? It is the same with dialysis. These are necessary, patient services for people to live. They are also in rural areas. We know transportation in Vermont is not great as well. So taking away these services from Vermonters is really, a matter of life. It really is unfortunate the decisions that the network has made to constrain these, to speak to the budgetary reductions. Instead of cutting managerial and administrative bloat, they have chosen to cut essential patient services and mental health services. That is not what Vermont needs. Vermont needs greater access and greater availability to care.